Hello and welcome to this Health Foundation webinar, System Mapping as a Tool for Action. We've had a record number of people sign up for this webinar and it's great that so many of you have joined us for the session. My name's Louise Marshall, I'm a Senior Public Health Fellow at the Health Foundation and I'll be chairing the session today. This is our second webinar on systems approaches in population health. In the first webinar, which is still available to view on our website, we made the case for complex systems approaches. In this one today, we'll be focusing on how mapping a complex system can be used as a tool to help you develop innovative responses to population health challenges. We've been working with Harry Rutter for the last 3 years as part of our Healthy Lives programme of work here at the Health Foundation. I'm pleased that Harry has joined us here today and has selected 2 brilliant speakers who can share their own experiences of using system mapping as a tool for action. There'll be a Q&A session towards the end of this webinar. As we've had so many people register, we've taken your questions in advance and we'll be answering a selection of these today. I'm now going to hand over to Harry, who will introduce our 2 speakers.
Thank you, Louise. It's great to be here today. You asked me to select 2 speakers who could talk about their own experiences of using system mapping to help them tackle complex public health challenges. In the room is Deb Richardson. In the webinar we did last year, I used a slide showing the work that we'd been doing with Deb and her colleagues on tackling physical inactivity in Derby. I'm really delighted that Deb is able to join us today to tell us more about that work and how it's developed over the last 12 months. But first, we're going to hear from Professor Steve Allender, who kindly agreed to take part while he was in the UK earlier this year. Steve's going to talk to you about his experiences of involving the community in system mapping approaches to tackle childhood obesity in Western Victoria, Australia, where he's based.
My name's Steve Allender. I'm the Director of the Global Obesity Centre based at Deakin University, a World Health Organisation collaborating centre for obesity prevention. And the title of the talk is Using Diagrams to Create Engaged Communities for Obesity Prevention. Most people, I'm sure, on the webinar will know where Australia is, but I'm going to talk about our work there in a minute. And I'm going to talk a lot about how we use diagrams in particular to engage communities in the work in obesity prevention. And as I said, most people will know where Australia is, but for those who don't, here's a picture that just shows where Australia is on the map, and you'll notice it's just up the top there. The other thing I do want to point out on this slide is the 2 Twitter handles on the bottom right of the slide. I'd be really delighted if you could tweet and let us know what you made of today. The work I'm going to talk about, we're an obesity centre that's interested in the prevention of childhood obesity, and we've been working at that for about 15 years. And what I'm going to talk about today is where we've gotten to in terms of the use of, in particular, mapping of the way people see complex problems and systems, and also the use of techniques to engage communities in the prevention of childhood obesity in particular. And what underpins that is our lessons over the last 15 years, particularly in 4 major trials in Western Victoria and Australia, but these then get translated into other countries. And what we've learned in each of these trials is some pretty important lessons. So the first thing that's important to say is that although childhood obesity seems to be an incredibly difficult problem, in fact we've discovered that it's preventable. And the graphics on the right-hand side introduce you to those various trials. Romp and Chomp were in children under 5. Be Active Eat Well was in primary school kids, Eat Your Move was in high school kids, and Eat Your Move ACT was in high school kids in Canberra and Australia, and has since translated into a policy position across that state. And what we've learnt from those is that to succeed in preventing obesity, we can't pretend that it's a single behaviour that's the driver, and in fact we have to understand the whole range of drivers, and above and beyond that we have to understand those and be able to change multiple things at the same time. We know that that takes a lot to get done. It's very difficult to get implementation to happen in prevention, and we know it's very difficult to make that sustainable. One of the major reasons for that is because the drivers are complex, interrelated and changing with each other and in different times. The other thing that's important to say about these trials is that the dose, the magic, the thing on the spoon, was in fact the local community taking ownership and leadership of a response to the problem. So that presents a pretty serious challenge, and that challenge is on the one hand we have to understand the complexity of the drivers of a problem, And on the other hand, we have to have people, leaders within communities, being able to understand that and use that in the development, implementation and evaluation of their efforts to improve the health of kids. And we lean fairly heavily on an approach called systems science to do that. What I mean by that, and I want to say a few things here about how we know we're thinking about things in terms of systems and also different approaches, is that many of these problems are actually changing over time. We often make the mistake of thinking about cause and effect in a static way. But in fact, if we think about what's happened to the health of kids over time, we know their diets are changing over time, we know their levels of activity are changing over time, and the things driving those changes are also changing over time. And we've so often forgotten to take that into account that a single drop in one part of a problem inevitably doesn't work. The second thing that stands out is that these issues are not linear, and that is that if we think we can introduce one activity and it will have a flow-on effect all the way through to changing a child's behaviour without other things changing at the same time, we're kidding ourselves. And I'll show you that in a minute. The third thing that's important to say is that we don't see this as a one-size-fits-all problem. So a community that I work with in Western Victoria is very different to a community in London, is very different to a community in Chicago. And we need to appreciate that and use the context as a part of the design of the response. In other words, we need to make sure what we do makes sense for the people in the community that we work in. Now, the textbooks don't use this phrasing exactly, but this is my phrasing. It's a tangled, evolving beastie. And what that means is that there's a lot of different things going on in lots of different directions, and it's complex. It's not just complicated. It's not just a lot of things we need to understand, but it's multiple relationships and changes happening between different things. The last thing I'd like to say about, in particular, systems science is it's important to understand that there are a long history over hundreds of years of different disciplines trying to tackle the idea of complex problems, more than 20 of them in fact. There are more than 10 theoretical homes for these changes and more than 50 established approaches. So it's critical to understand that what I'm talking about now is from one particular approach, and we're borrowing heavily from an approach called system dynamics, but particularly participatory system dynamics, and that we are using it adapted to context. So the purists may not necessarily agree with several of the things I'll say. I also want to make this point, and that is, this is where the idea of beginning to map how people see systems or causal loop diagrams starts to become really important. There are different levels of insight which we can reach when we think about a complex problem and when we think about a system. And in fact, a starting point is just to understand, assume, learn and realise that there is a system underpinning what happens in terms of behaviours of kids or in terms of any complex problem that we're trying to solve. Understanding that that system has different components, that these components are related in particular through feedback, they work together and they work against each other, and how we might start thinking about system are all actually fairly important tasks before you can approach the idea of, well, what do we do about this if we're taking this complexity into account as a part of our effort? And I'm going to talk a lot in the next 10 minutes about how we use pictures and diagrams to do that, but I want to make a really important point. That's not the whole basket of work that systems has to offer. So if you look further down this graphic, you can see that actually there are graphical models and other approaches we can take that begin to get more in-depth understanding and begin to allow us to understand in more practical terms just exactly which parts of a problem are driving which outcomes. And at the very top end of understanding, we can work into mathematical simulation of the ways that problems work together and what different interventions in different systems do in a mathematical functional way to changing a system. But today what I'm going to talk about is really the top third of this picture, in particular the way that we're using diagrams, and how we're building those and how communities are using those to help with their efforts. Apologies for the quality of this graphic, but it hopefully speaks to how new this science is. So the way that we work is a catalyst will come to us and have a problem that they're very keen to work on, and in childhood obesity it's quite often a local health authority or a local health leader. And the catalyst is someone who's passionate, and it's within their remit to solve a problem. So in our communities they come to us and say, we'd like to work together to do something about this problem. Our starting point with the catalyst is to ask whether or not the leaders are engaged in the problem. And when we talk about leaders, we're talking about leaders of the local retail associations, leaders of local government, leaders in the local education sector, and community leaders, people who have huge reach into a community and huge authority. And we're really looking for people who have the authority and the power to make decisions to change environments that will solve the problem, and who can connect people and release resources towards solving the problem. What we do with those leaders is we have a first 2-hour session where we invite them for a breakfast or a lunch, and using the software that we've invented, we ask them the question, when we think about this problem and how it's changing over time, what else is changing that's led to this problem or resulted from this problem? That allows us to begin building a picture of all of the different pieces of the puzzle that we need to consider. So the question we ask is, if we're going to build a picture of this problem in terms of trying to find solutions, what has to be in the picture? We then look for cause and effect between those variables, and the software helps us build a picture called a causal loop diagram. I'll show you one of those in this session. And that causal loop diagram then allows the leaders to see how the complexity of the situation works for them. We then ask the leaders, if this is the evidence about solving the problem, if this is how you see the complexity of the problem, who else needs to be here to help us solve this problem together? And the leaders will go and recruit other people from the community assets who can help us do this work. And typically they include people who are then doing on-the-ground work in terms of changing the environments where this problem might occur. So this is, for example, lead teachers, maternal and child health nurses when we think about breastfeeding of kids, key GPs in the community. And those leaders bring the broader community to a third session, which is typically half a day, where we work with them for the leaders to help explain how the maps work, to confirm that that makes sense to the community members, to show them the evidence about what we know about the problem, and then ask the question, if that's the evidence, if that's the map of the complexity, what's possible? And that room full of 100 or 200 or 300 community members will then come up with 5 or 6 ideas each. So we'll end up with 1,000 different ideas about what we could do to solve this problem. We then ask to prioritise those in terms of likely impact and feasibility. So we need to be able to find things that are doable. And we then theme those in terms of the different areas of the system in which they're working. And what happens then is the whole community forms different working groups on the basis of the part of the system they're prepared to work on fixing. So instead of a single agency competing with all the other agencies for funding to deliver a single program, all of the agencies who are interested in the health of kids are asked the question, well, if this is the problem, how do you fit into the solution? We've invented software to help communities do this. It's called Sticky, and essentially what the software does is help us ask the leaders in the community what are the drivers of the problem, place them in context of each other, find the connections for them, and then find the ways in which they interact with each other. I'm going to show you one of these pictures here in a moment. I don't want you to panic. It looks horrible and it looks complicated, but I want you to understand that this is from the point of view of the community, and in building it with the leadership, and in building it with those people who have authority to make a change, they have ownership and understand this problem. So here goes. So this is the way that the community of Hamilton in Western Victoria and Australia see the problems of childhood obesity. To make life a little bit easier, I'm going to zoom in on one part of this and talk about how they use this. But as I'm doing this, I want you to remember that this is one part of this much larger map. And so I'm going to zoom in that square in the top left. And what you can see here is this is the relationship between water consumption and sugar-sweetened beverage or soft drink consumption. And our typical approach to a problem like childhood obesity would be to say, you know, our cross-sectional data tell us that those kids who drink too much soft drink are overweight or obese. So what's the obvious intervention? Well, obviously what we need to do is stop them drinking soft drink. And actually it might be a bit more complicated. Maybe if they drank more water, they would drink less soft drink. So what's the intervention? Let's give everybody a water bottle and tell them to drink more water. Now in the community that we're talking about here, and this is where context becomes important, the tap water has a different taste, if I can put it that way. It's very safe, but it has a high mineral content, and many people find the taste a little bit off-putting. So even in this simple example, if our starting point is to say, please drink more water, and the water out of the tap is problematic, then already this intervention is going to fail. And this simple insight from this simple picture is actually incredibly powerful. When you look at this picture, you start realising that if we are going to increase water consumption amongst these kids, there's a whole bunch of other stuff we have to understand. The cost of bottled water, access to drinkable water, and many other things. And in fact, what happened, we were working with the leaders, and that included the CEO of the local health service in this region, and we did this piece of work, and he looked at this picture and he said, well, hang on a minute, surely there's something we could do about this. And in fact they did. And what they did was they changed the policy in the health service to ban sugar sweetened beverages completely from the health service. So overnight, by giving the leaders the tools to make this change, they completely changed the environment for everybody going in and out of a health service. Within 2 weeks, he'd made that happen across 13 health services in the region, and they were the first health services in Australia to ban sugar sweetened beverages. Let me put it a different way. You're a parent, you need to get something to drink on the table, you go through the supermarket, and this is the supermarket aisle. You know your kids should drink more water, 75 cents for a litre and a quarter of cola, $2.15 for a litre and a quarter of water. This isn't even a choice. And yet if we don't understand the complexity of the drivers of the problem, our intervention is to say, please drink more water, and then get annoyed because people aren't drinking more water. So again, this is just giving one example of how these maps help you to find different ways. The other thing it allows us to do is to begin explaining what the changes were that happened that led to the change. So if you look at the top left there, we had monitoring data where we understood the patterns of consumption amongst the kids, and we had some other markers of their health. That monitoring data led to an increase in the awareness of the issue of the kids' health, which engaged the leadership. And at the same time, it engaged the key people in the health service and created the conditions where it was easy for the health service leader to make a change. And in the bottom left here, you see the CEO of this health service, Rowan Fitzgerald, with a very confused canteen manager being told, you're going to be selling a lot more of this stuff in the next little while because you can't sell sugar-sweetened beverages. And in fact, they went further than that, and they created a policy of 80% green foods across the health service, a ban on sugar-sweetened beverages, and organisational KPIs to halt the year-on-year rise in obesity within the next 5 years. And in the communities we work in, by giving leaders the opportunity to see the maps, what we're asking is, does this represent the way you see the problem? Can you see how you fit into this problem, and what is it possible to do within remit, interest and capacity? The question is not what could we do if we had an enormous amount of funding and bought something in from outside, but as a community, what do we have available to us to make changes that will improve this situation? And here is just a short list of some of the different changes that have happened, and in fact I'll show you this a different way in a moment. But there have been changes to the way that local government works, there's been changes to the way financial procurement happens, there's been changes to the way schools allow their children to arrive. So for example, the schools have exclusion zones around them where you can't drop a kid any closer than a kilometre from the school. So the children went from about 5% of them were active enough to have a health benefit to 95% of them getting 45 minutes walking in the morning and in the evening. And the difference was giving the leaders in that community a way of seeing the complex drivers of the problem using the mapping approach and asking, how do you fit into a solution? This is another one of a community's maps, and again, you'll be looking at this and going, that's just a horrendogram, that's a horrible thing to look at. But when it's built by the community leaders and shared with the community, this makes full sense and it's perfectly understood. And this is in Portland in Western Victoria, a town of some 17,000 people. And alongside this, we're doing a step wedge cluster randomised trial, which has a 90% measurement of kids' heights and weights and behaviours in that town. And what we've found is within 2 years, we are seeing significant changes in the behaviours of those kids. So the circled areas show where there's been changes. The green dots here, each one of those represent a different activity that community is taking. So if I go back to my example about water, water is in the bottom right here. Traditionally, we would have said, gosh, what's the one program we should run that will solve this problem of our kids not drinking enough water? And in this community, there are 20 different actions that have sprung up right across the community to try and do something about this. And they've seen statistically significant increase in the consumption of water and statistically significant decreases in the consumption of sugar-sweetened beverages. And we're seeing changes in other parts of this community's system in terms of active transport and in other places as well. What's also interesting and useful here, and Sticky allows these communities to track the changes that they're making and to overlay whether or not their efforts are having any success. You can see other places here where a lot of effort is happening, but there doesn't seem to be much change. Participation in sport on the left has a lot of activity happening around it, but there's no significant change. And the reason for that is that most kids are already active in sports. So most kids, 92%, are active in sport. There is no increase to be had. It also allows the community the opportunity to start thinking where are our efforts best spent and how do we work together to find different ways to tackle this problem. So where have we gotten to? I want to make a few points. Systems thinking is not one thing. It's a range of disciplines, a range of techniques, a range of depth of insight with multiple purposes and multiple audiences. And it's critical at any stage to fully appreciate what the objective is, who the work is for, and therefore what the best technique is to use. And there are lots of frameworks and approaches. We use system dynamics, social network analysis, agent-based models, soft systems methodology. And the maps that I've shown you really are built using a combination of several of those different techniques with a lot of experience and science feeding into them. One of the challenges here is fidelity of intervention. And what I mean by that is most people who do clinical trials are very concerned that there's high fidelity of intervention. I want to see whether or not my tablet works. That means I need the person to take it at 10 o'clock every morning and they must take it every day. We are deliberately asking communities to generate as many possible actions as they can in light of the evidence and in light of their understanding of the complexity of the system they're working in. Once they've generated those actions, and a community will generate 500-600 different possible actions, we then prioritise those on the basis of what's most feasible and what's going to have the highest impact. And so really we're interested in the fidelity of the process. Have we got a process that any community can use, and how does the mapping fit into that broader thing? The other challenge, which is difficult for funding bodies and for academics, is attribution versus contribution. If we build the capacity of a community to solve a complex problem, and they do, it's quite difficult to put your finger on the single event that happened to make that change happen. Having said that, we are using traditional evaluation techniques to try and address that, and we are seeing significant success both in childhood obesity but also in other fields where we're being asked now to work in many other different fields, including homelessness, domestic violence, youth health and wellbeing, and many others. Thank you very much for the opportunity to talk to you today. I hope you enjoyed that session. I just want to acknowledge some of our partners and some of our funding bodies. Thank you.
A fantastically clear insight there into Steve's approach to systems mapping and the key importance of involving the community. We're now going to hear from Deb Richardson, who will talk about her experiences of using system mapping in Derby. Thank you, Deb.
Thank you. Okay, thank you, Louise and Harry, for inviting me to join you today at the webinar. As Louise mentioned, I'm going to be talking about our experiences in Derby City in terms of how we've used system mapping as a tool for action, specifically in relation to tackling inactivity. And just to give you a little bit of background, the concept of systems approach, of systems thinking, was first alluded to in a successful partnership bid for a project which was funded through Sport England, referred to and known as Derby, a City on the Move. The partners involved in the project are Derby City Council, the University of Derby, Derby County Community Trust and Derby College. The project itself is funded through Sport England through the Get Healthy, Get Active funding stream, and it's a 3-year funded programme, along with partner contributions which are predominantly in-kind contributions. After the initial 18 months of the project, there was a lot of progress around the data collection systems and also around specific interventions which partners had signed up to. And those interventions were targeting communities around workplaces and older adults specifically. Now, after 18 months, I came in to support the team to look at how they could move forward and progress on the work that they were doing for Derby City on the Move. And this provided an ideal opportunity to reflect on where we were, not only in terms of the data collection systems and processes and the interventions, but actually how we were working to achieve this systems approach, this vision that we had in the initial outset in the bid documentation. But in order to do that, we had to have a common starting point. and a vision, a shared vision of what we meant by a systems approach across Derby City. We needed some clarity on the definition and the action that we needed to move forward. And in order to support us to do that, we commissioned Cavell Associates with Harry Rutter, who's here today, and Nick Cavell to help us to really define how we could move forward with this area of work. And the process that we went through initially was a baseline review. So about 12 months ago, Nick and Harry supported us to achieve this, this baseline review. And the processes that were involved included a workshop of the consortium partners and also further discussion and one-to-one meetings to find out really the programmes, policies and data sets that were in place across Derby City. But this was taken just from the perspective of the consortium partners at the time. And the reason for that is because, as I mentioned earlier, it was first alluded to through the partnership bid for Derby as City on the Move. So the initial starting point for this work was to look at the perspective of the consortium partners. What in their minds did they feel were the main determinants of physical activity across Derby City? And what were the factors that were inhibiting progress in relation to tackling inactivity? And the output from that was a visual representation as a causal loop diagram. Now, this diagram I know looks quite messy, I guess is one way to describe it, but this reflects the partnership or consortium partners' views of what the factors were that were impacting on the physical activity levels at that point in time. But as I must stress, this is from a consortium partner's perspective. And the reason why I say it looks a little bit messy is because when you first look at it, you think there's a lot to do with that. But actually, I'll explain a little bit about the various elements of this. So the review started by, if we look right in the direct centre, the overall outcome for all the consortium partners who signed up to the bid was about helping people to move more, looking at total physical activity. We then have the three larger circles in the middle, which is around the physical activity opportunities, around the active environments, around cycling for transport, around walking for transport. And we're looking at those kind of physical activity opportunities that existed. On the right-hand side of the map, we're really focused on kind of behavioural aspects that impact on activity patterns. So ambivalence to physical activity, the habit forming, and a number of other areas around behaviour change. To the left, there was more around the environment and around infrastructure, for example, cycling, cycle lanes, access to walking routes. And the top looked very much around the perception of Derby as an active city, social norms, what were people's perceptions of Derby? And so this is a total model, let's say, or as a total diagram or map, was a reflection of the discussions that took place with that baseline review of the partners. And if this was a perspective of kind of the whole physical activity system, what we needed to understand was the contribution specifically of Derby as City on the Move. And through this process, what we found was that the interventions that were in place, as you can see by the orange circle, that represents the programmes and interventions for Derby as City on the Move. And the majority of them focused on behaviour change. Now, there's a reason for that. Because of the nature of the funding stream, the focus was on tackling inactivity, and it was around engaging inactive people and moving people and showing that shift in physical activity. So the focus had been very much on interventions that would enable you to assess at baseline, track at 6-10 weeks, and then follow up over a 12-month period. But in terms of the place of Derby as City on the Move in relation to that system that has been developed or mapped out by the partners, as you can see, it represents quite a small part of that system. And so some of the results that came through, as I mentioned, it does contribute to aspects of a whole system approach, because there is a whole population focus. There are very close links to Move More Derby, which is the physical activity and sports strategy. There is a very clear focus on behaviour change and interpersonal interventions, because at that point in time, that's what consortium partners were tasked to look at. And so all these things were done well, but it did represent a small aspect of the system. And that is unlikely to have a population level impact. So individual level interventions have their place, but if we really truly want to see population level impact, then we need to look at doing things differently. There was a recognition across the consortium partners that there was a wider system in place. They'd mapped out the wider system, but there was also a recognition that they didn't currently link into that because they were working on their discrete projects and interventions. Also, what came through was that the connections across the system were varied. So whilst there were a number of areas that were mapped out in terms of active travel, in terms of quality of green space, the connections between all those different aspects was very varied, and also the knowledge. So the knowledge of what was actually in place across Derby City was very varied. And in terms of data and data that was collected, the projects aligned to Derby City on the Move collected data that would allow us to feedback and report into Sport England. So as I mentioned earlier, it's about tracking changes in physical activity behaviour. But what this mapping process did was identify other key data sources across the rest of the system. So there's a whole host of other data that was available through Derby City Council and through some of the other partners that helped us to get a much better understanding of the available data across all aspects of the system, and also some unknown or programs that had not at that point in time been linked and joined together. So the recommendations, there were a number of recommendations, but I'm just going to pick out a few for you. The first was a minimal data set of core indicators to monitor changes across the system. And the reason for this is Derby City on the Move, as I mentioned, collected specific project data. There was a whole host of other data that was available across that system identified by the consortium partners. And remember that if we had expanded out and asked other partners beyond the consortium, then that would look even bigger. The number of data sets coming through would expand. So what we needed to be clear about was what we were trying to measure. What changes were we trying to make? Because unless we knew that, unless we had some clarity on that, we would never know whether we were progressing towards this whole system approach to tackling inactivity. There was also a recommendation around expanding partners beyond the consortium. And there was a lot of discussion around this at the time in terms of expanding Derby City on the Move, and for that to take on the whole system approach and the vision that it originally alluded to, and to look beyond those, as I mentioned earlier, some traditional and non-traditional partners. There was also a need to learn from Derby City on the Move and the recommendations from the whole system review to feed into the development of the Move More Derby physical activity and sports strategy. And that presented a real opportunity and also created a lot of additional discussion in relation to whose responsibility and role should it be. 18 months into the project, moving on to 2 years, was it appropriate for Derby City on the Move to expand out and try and achieve a whole system approach within the time span of that project? Or was it more appropriate to assign or align the concept of a whole system approach to the Move More Derby physical activity and sports strategy, which at the time was still in development? And after many discussions, it was decided that the latter was much more appropriate. It was much more appropriate to focus and ensure that the Move More Derby strategy, which was a long-term vision for the partners and a much broader range of partners across Derby City, would take forward the recommendations from the initial review. Derby City on the Move will still continue with the projects and will still contribute in the way that it has been contributing. And in order for this to happen, then there is this need to focus some focused coordinated action involving the wide range of stakeholders, as I've mentioned. And with this process of review, it has taught us a lot. But there is a need to continuously review and refine the mapping process in order for it to be helpful. This is not a fixed process, and we were very aware that this is not about the creation of a map. This is about all partners understanding what we mean when we talk about systems thinking, what we mean when we're trying to create a system change. This is about the action that comes out of the process as opposed to a fixed map and a visual diagram. So the progress over the last 12 months, it has been significant in informing the development of the Move More Derby physical activity and sports strategy. The awareness of the place of Derby City on the move in the whole system approach to tackling inactivity across Derby City. And what it's also done is help to strengthen the priorities of the Move More Derby strategy. It's enabled a wider partnership engagement. Again, beyond traditional partners. Traditional partners are extremely important, but we need to go much further than that if we are truly to create this whole system approach. And to show that this wasn't just something that was being discussed, that we were looking to continuously review and refine the process, we conducted a remapping, supported again by Harry and Nick, just last month with a wider partnership. And indeed, what we found was that the map that was produced was expanded out in terms of the data sets, in terms of the programs, in terms of the policies. But as I mentioned, it's not about the number of nodules or nodes that we put on that map. It's about the action moving forward. And what that process did, that remapping did, was create discussion across partners who had not necessarily been joined up before in the same way, or had been joined up but have found a different opportunity to work together. So it influenced a number of things. And the last bullet point on there refers to the priorities for the Move More Derby physical activity and sports strategy. And again, not only does it underpin some of that work, it supports the development of the priorities moving forward. And the reasons for that I'll mention in a few moments. The point I haven't referred to is this minimum core data set in development. This is something that has been a really helpful process. The core data set is now being looked at through the public health team at Derby City Council in order for us to agree on what we are trying to measure and what the outcomes are that we are trying to see. And again, that will all feed into the priorities for that strategy. So some of the benefits I think that we found by using the systems mapping across Derby City. We have an agreed definition and understanding across the consortium partners, and that is now extending out to the broader partnership who attended the remapping process last month. There is also, I think, a greater awareness of the importance of individual interventions, but also that we need to do more, and we need to do more in order to influence a population level change. But everything has their place. And we can't negate the importance of those specific individual interventions for targeted communities as well. The benefits also in relation to connections, the potential for connections was realised. And what I mean by that is that we started to look for the first time about how different areas of that map joined together and look for ways that they could join maybe better, more effectively, more efficiently. Whilst I mentioned it's not about a map, what it did do is provide a visual impact for all partners. So we could see clearly what we were talking about as consortium partners, and then the broader partnership and the place of certain programmes of work like Derby City on the Move. We also had this information reveal, because what we found through this process is the pockets of data and programmes and that were in place on policies that not only contributed towards physical activity, but could also have could support this process of achieving this whole system approach. And also help with the identification of gaps, both in knowledge activity and data. But it's not without its challenges. You know, if the process of systems mapping was easy, then everybody would be doing this and would have been doing it for a long time. But it isn't. It brings with it its challenges. And one of which is the engagement of wider partners and knowledge base. You know, how do we go about engaging partners who previously have not necessarily been engaged in a discussion around tackling inactivity? A perception of maybe there's just too much to do. When you start to map out, we may have had the engagement. When you start to map out all the areas or all the different ways and things that can impact on physical activity patterns, then it's sometimes easier to kind of think you'll stay as you are, carry on doing what you're doing and maintain the status quo. The identification of gaps and recommendations, that's really helpful, but what next? Who's going to do that? Who's going to move forward with that? And the way that we've addressed these challenges in Derby, across Derby City, is through the Move More Derby partnership and bringing people and helping people along the journey that we are now currently going through. It's around for partners who we have not worked with before and the partnership hasn't worked before. It's about framing physical inactivity in a way that helps them to identify how it will contribute towards their broader agendas. So it may not be a physical inactivity issue for them, but if physical inactivity and addressing physical inactivity can contribute towards the achievement of their broader outcomes, then it increases the likelihood of engagement. And the perception of too much to do. All areas of that map, we can take different aspects of that and really drill down into some of the detail. So at a snapshot, it might look like there's a lot to do. And there is if we take the system as a whole, as a complete process at one point, but it isn't. And it is dynamic, and it's important to look at the priorities of the communities and look at issues that they're faced with and the key things that they would like to see changed and taken forward, and look at prioritising those areas. And the gaps and recommendations, I say identification of gaps, it's identification of opportunities. It's the opportunities that exist and recommendations and what next. And the partnership have a role to play in that. It's important that you have the people on those partnerships, as we do across Derby City, that can make decisions. They can make decisions and they can make things happen. So we have the consultation with communities, involvement of communities in terms of the priorities they would like to see addressed. And we have the people on the partnership who can actually make those things happen. So we are at the start of a journey, but we are working together as a Move More Derby partnership in order to work together to achieve this whole system approach to tackling inactivity. Thank you.
Thank you so much, Deb. Thank you for sharing your experience in Derby. Fascinating to hear about how the systems perspective has influenced your approach to promoting physical activity and the benefits and challenges that it's brought. I was particularly interested to hear about the sheer value of this in engaging partners and creating that shared understanding. Harry, what are your reflections on what we've heard so far today?
Yeah, thanks, and thanks, Deb. That was really interesting. I suppose there's several things to say. One is there are clearly lots of different ways of doing this. There isn't just one process. What Steve described he and his colleagues have been doing in Australia there's a lot of similarities, but there are also differences from the work that we've been involved in and you've been doing here in Derby. The key to it, though, the common thread through all of it, is that this is a process that is driven by the stakeholders. We can facilitate it, we can help it, we can help to shape and guide it, but actually the content comes from the people on the ground who are actually who know that place, know the situation, know what's going on, understand the context. And I don't know if you use this phrasing exactly, but the point you made, I think, is absolutely right, is that paradoxically, system mapping of this kind is not about the map. There are absolutely situations in which the map is an end in itself, and those are equally valid, but in this situation, actually, the map's important and it has a lot of uses, but it's much more about the interactions, the conversations, the discussions, the challenges that take place between the people in the room together, trying to make sense of their own particular roles within a system. It's not about, and you made this point extremely well, it's not about a fixed point in time. This is about some stuff we do in the short term, some stuff we do now, but we've also got to think about the medium and the long term. We're not going to solve these messy problems overnight, and helping to bring that out, I think, in and of itself can be useful and instructive. And yeah, I suppose, I think I'd really want to emphasize this point about the people. And it creates challenges. You can't involve everyone. There has to be some selectivity. Some people self-select themselves out of this process anyway. But it's the range of perspectives that one brings together that really adds the richness to this process. And it was great to hear both you and Steve emphasising that.
Thank you, Harry. So now we're going to answer some of the questions you've sent in advance. The first one we've selected is about simplicity versus complexity. So do you have any hints or tips about how balancing being too simple with being overwhelmed with complexity, and how much detail and depth is enough?
I suppose in some ways I'd come back to what I was just saying, which is about the individuals, the people who understand the particular system that you're looking at, and in one sense it's for them to decide. Yeah. What's the particular problem that we're looking at here? What are the kinds of factors that, what's the level of detail, what's the level of depth that is important for the kinds of factors that that make sense to those stakeholders, those people participating in it. And I thought Steve illustrated it brilliantly. He's got a big, messy, he called it a horrendogram, big, messy map of the drivers of child obesity in that particular location, but he was then able to focus down within that and say, okay, there's all this other stuff going on, but let's just, for example, look at sugar-sweetened drink and water consumption. And then he went beyond that to look at the role of the health service in tackling that particular question. So I think, it's a bit of a how long is a piece of string question, but this particularly comes up when you've done the first phase of a map and you've got lots of post-it notes or whatever, you've got a lot of nodes, then you've got to work out how you draw the lines between them to say what are the levels of connection that matter, because you could, if you really stretch it, you can draw a line between anything, but that's not terribly helpful. You've got to think, what are the helpful connections? What are the helpful, meaningful relations between things where there might be some leverage and there might be an opportunity for action? And I think that's for the people driving this process to work out for themselves.
So Steve touched on some software that he uses to map systems. What other forms of software have people used to record or map systems effectively?
Yeah, there's a lot of questions come through about the software, and I remember when I first got into this, thinking, God, what software are we going to use? Steve's got his sticky stuff. We don't have that. What can we use? And in some ways, I think it's a red herring, because actually what matters is getting one's head around the idea of what we're trying to do here. And the software is absolutely secondary to that. I mean, you really can use post-it notes and bits of string. But for some of the maps that we've been doing, there's lots of free software out there. There's something called Vensim you can use, which can be used for very sophisticated purposes, but can equally just be used for drawing maps. One I'm using most at the moment is something called Kumu, which is a website. It's an online tool for limited use. It's free of charge. But really, I'd say it's not fundamentally about the software. The software is just a tool to help you provide a visual representation of what you've got to get your head around first.
Sure. So we had quite a few questions as well about taking account of dynamism and adaptation within systems. So with systems mapping, how do you take into account the fact that the health outcomes, the causal pathways and the populations themselves are so dynamic?
Yeah, I mean, that's kind of the point, isn't it? I mean, Steve made a point. I can't remember his exact words, but he specifically said, this is a system in which the drivers, the individuals, the factors are all changing over time. And part of the purpose of this process is to track some of those changes, see where you're making a difference. So it's very different from sort of a fixed model of public health where you can say, here's the relations and these stay as they are, which is pretty unusual, of course, but makes things easier if things don't shift. But this is absolutely about getting to grips with grappling those dynamic changes and trying to influence them.
Yeah, and just to build on it, a point you've made there, Harry, it's a perception of what we're talking about when we're talking about systems map. And I think sometimes when we use that term systems map, the perception is that it is exactly that. It's a map and it's a fixed point. And I think I referred to it in the presentation, and Harry's already picked up on that, in terms of this is a fluid process. It's around changing in system thinking. So if we have something that's static and we try and weave in things that are dynamic, then it seems like there's a mismatch. But actually, we're not talking about that. Systems thinking is about a dynamic process that is ever changing, and that those factors within it that are dynamic will be part of that process in terms of understanding more about how you can influence the system and support that system change.
Thank you. And given that fluidity, and given the sheer number of people involved, how do you even begin to validate a whole systems map?
I'm not sure what that means, really. It depends what you're trying to use it for. So if you're trying to use a map as the basis for a system dynamics model, where things do have to be fixed a bit, or at least some of them do, because you're going to try and put some numbers in and model potential change over time, then I think it's beholden on the people putting the map together, because that map really does matter then, to use the most robust and reliable available evidence to underpin it. And you could then potentially test it against other ways of measuring and estimating those relations. But for the kind of stuff we're talking about here, the map is the process of, is the outcome of the process that has taken place with that set of people on that day, with that set of perspectives, those set of objectives, to try and make sense of their view of this particular system. So people in Derby working on physical activity, if you get 30 key stakeholders from Derby working to reduce physical inactivity in Derby to produce their map of the system that they collectively have some influence over, you can't get more valid than that. I mean, it validates itself because it is the product of the people in that room. And I think some of the criticism of this work is from people who perhaps think that we're trying to do the stuff I discussed, the former, the more robust quantitative mapping, when actually this is much more of a qualitative process. It's an engagement process, and it is a process.
Yeah, and I would completely agree with that. I think the validation, from my perspective, comes exactly from that point of it's being developed by those organisations, as the key, say, areas of that impact on activity levels, but also around the consultation with the communities. And I think that's where we are with this at the moment in Derby, because we have developed this map, but as I said, it's more about the thinking and processes and engagement of partners. So that has happened, but there are certain communities that we are going to be working with more closely. And we want to look at the very specific areas of the map to see what it is that specifically influences their ability to, for example, walk to school, the park, college. So we're drilling down into that level of detail. So the validation that comes through not only from the local partners and that senior level input there, but from the communities themselves, again, provides the validation from both sides.
And if we come back to, thank you, I agree. And if we come back to what Steve was describing, Steve's validation is that they are seeing significant changes in behaviours. They're seeing significant changes in outcomes through this process of engagement.
So again, coming back to that key point of who you involve and who you engage in the process. And just related to that, we had quite a few questions about how to engage stakeholders who might be resistant to the approach. Have you got any advice here?
I think there's always apprehension. I think when you start a process like this, even from partners that you may have engaged with significantly in a lot of other areas, partly because it's something new, it will require time, it will require effort, and people are very busy in their day-to-day jobs. And so I think there's always going to be a level of apprehension. It's just how much of that there is. And I think one way is almost a reframing, and we talk about it a lot with a range of different things that we're trying to achieve within public health, but certainly within addressing physical inactivity, it's around ensuring that partners can see the benefit to them of their broader outcomes. So we have to reframe physical activity and tackling inactivity in a way that helps partners to understand how it can help to support them to achieve their broader outcomes. And also, I think once they've then engaged in the process, the mapping process that you go through really helps to firm up that this is around a whole host of things and a whole host of system changes that need to take place. So it is about that constant reassurance, I guess, that it is worth time and investment if you truly want to see a shift change, but also in terms of achieving much broader objectives and much broader agendas across those communities.
Can I add something, please? I also think it's really important that we don't only invite people to these sessions who are going to say the things that we expect them and want them to say, and one needs to be open to resistance and challenge, perhaps not as far as hostility, but maybe even people who are hostile to what's being proposed, because that improves the validity of what gets produced. And I think it's incredibly important to have some critical voices in the room. So one should do what one can to engage people who think this is nonsense, as well as people who think it's a great idea.
Thank you. So a lot of people also sent in questions about how you evaluate interventions in complex systems. This is worth a whole webinar in itself, so we're planning one on this topic next year. And we'll be in touch with everyone who registered today when we launch this. I'm afraid that's all we have time for today. I'd like to thank Carrie Rutter and our two speakers, Steve Allender and Deb Richardson. I'd also like to thank everyone who joined us today. I hope you found it useful and that it's given you some practical tips. The webinar will be available to watch on demand, and we'll be in touch as soon as it's available on our website. Thank you.